I'm Melanie Dreher. I'm Dean of Nursing at Rush University Medical Center. I'm a nurse and an anthropologist, and I think I've been doing cannabis research since, well, it'll be 40 years, since 1970. And the majority of my research has been in the country of Jamaica. My first research project was looking at men, working class men who smoked marijuana, or ganja as it's called in Jamaica. And I was part of a large socio-medical study in which 30 users and 30 non-users matched for socioeconomic status and age were compared with a battery of physiological and psychological measures. And I was really responsible as the ethnographer, a very junior ethnographer at the time. I was a doctoral student. And I was responsible for actually identifying the men who would be in the study and then getting them there and tested, and then doing the follow-up with a series of questions and interviews. And that really led to my dissertation research, in which I looked at a common theme in the United States, which was this notion of amotivational syndrome. That if you smoke marijuana, you lose your ambition, you drop out, you don't feel like going to work, you lose your sense of personal accountability or responsibility. And in my very brief introduction to ganja in Jamaica, it was clear to me that men were using it in just the opposite way. They were using it to help them work harder. And so I wanted to test that concept of the amotivational syndrome cross-culturally. So I looked at men who were farmers and cane workers, and we had actual measures of productivity on cane farms, sugarcane farms, because each man was attributed so much cane, the cane that he cut and the cane that was packed into a cart to take away. Cutters were different from the packers. But we were able to measure productivity in terms of cane cut and compare users and non-users. So that was pretty interesting, because even though the amotivational syndrome would say that it makes you work less, and Jamaicans would say it makes you work harder, basically there was no difference between the users and the non-users in terms of the amount of cane that they were able to cut over a period of time. But I think that we can't neglect the notion that if you feel and if you're motivated to work, if you're taking a substance that makes you get up and sort of push the envelope, work harder, and you come out, you know, at least with as much work performed as the men who didn't cut cane, I think that says something. So I looked at the, in addition to looking at work productivity, I looked at the value of cannabis or ganja in the lives of these men, the social value of it, the ritual value in terms of its use as a sacrament in Rastafarianism. I also was able to look at the medicinal value that it had in terms of teas and tonics and poultices and other preparations that really were applied to a variety of medical circumstances. In Jamaica, they call marijuana the king of herbs. It truly is a master herb, and it's used for many, many things. Everything from babies teething to reduce some of the pain and inflammation with that occurs during teething, to asthma, gastrointestinal complaints, getting better sleep. just a variety of medicinal uses. So that led me to the next study, which was looking at school children whose parents administered tea, marijuana, or ganja tea to their children prophylactically a couple times a week, not in response to any serious illness, but to help the children concentrate more in school and to promote their health and to keep them well, robust, good, sturdy, strident children. And unlike here, where parents who give their children marijuana are considered bad parents, in Jamaica, it's just the opposite. They are considered very good parents. They have taken that precious store of ganja, and instead of smoking it themselves, they have used it to prepare teas and tonics for their children to protect and promote their health and improve their intellectual performance in school. So I did that little study, and then during that study I realized that increasing numbers of women were beginning to smoke marijuana in a pattern not unlike that of men. Typically in Jamaica, men smoked and women drank ganja. And women who smoked were negatively sanctioned. They were considered sort of brawling and not ladylike and all those kinds of cultural values that attended smoking by women. And at that time in the United States, we had just finished the thalidomide incident in the United States, and people were very interested in the teratogenic effects of cannabis use and the impact of cannabis exposure on neonates and perinatal outcomes as well. And I'm trying to remember, I think one of the reasons that we were able to do that study in Jamaica, to look at women who used cannabis during pregnancy and then follow up on their infants later, was because Jamaica was one of the few places where you could actually separate cannabis from other drug use. In the United States, many of the women who smoked cannabis were also cigarette smokers, alcohol drinkers, used other substances, whereas in Jamaica it was a pretty clean sample. Women might have a beer occasionally. They might, in the rural areas, you bought one cigarette at a time. So usually women would buy maybe a cigarette or 2 cigarettes for the dance on Saturday night, but that would be all the cigarettes they would smoke. So it was possible to tease out the effects of ganja. And so we followed those women. We had used the same model as the original study. We had 30 women who were users, 30 non-users. They were matched for the number of children they had already had, for age, for socioeconomic status, and then we evaluated their babies during the neonatal period at 1 day and 3 days, and then at 1 month. And then later we were funded by the National Institute on Drug Abuse to do a 5-year follow-up on those same children. The children who were the marijuana consumers, or the ganja consumers, tea drinkers, did consistently better in school than the children who were not consumers. We had asked the teachers to rate the children ahead of time and say, which children do you think get ganja tea and which children do you think get no tea? And of course the teachers are from the middle class of Jamaica, and they were very consistent in their notion that the best children in the class were obviously the ones who didn't drink marijuana tea. So they were really surprised to know that, in fact, those were the children who did get the tea. I'm not sure whether the tea itself had any impact. And I think we could do the study again and really find out whether that was the case. But they were certainly also the mothers who, and fathers, if they cared enough about their children to give them ganja tea, they also cared enough about them to make sure they had clean school uniforms, pencils and paper to write on, little books to read at home, that they did their lessons at home. So it was really, the ganja tea was an artifact of good parenting. And so it would be really hard to separate out what was the good parenting part and what was the specific effect of ganja tea. Although recently we have heard the potential impact of cannabis on memory, on the ability to select certain things to put into your memory. So that ability to focus and to filter out extraneous kind of activity and input. So it would not surprise me if we were to do this study in a more controlled environment to see that when you put children in a classroom with 50 other children and one teacher, and they're sitting squeezed together at one little desk, that you might find the children who drank ganja tea would probably have an increased capacity for concentration. But it'd be fun to do the study in a more controlled way. Jamaican parents like to give their children tea because, of course, they walk 3 or 4 miles to school, but they want to make sure that they're well nourished and that they have hearty appetites, and they believe that the cannabis tea gives them a good appetite and makes them grow in a more robust way. And of course, the children at a very young age are expected to help their mothers and fathers both in household chores but also out in the bush with their farming chores as well. So they want their children to be strong and healthy, but also very smart in school. Well, the neonatal study was very interesting because at 1 day and 3 days there were absolutely no differences between these two categories of neonates, the exposed and the non-exposed. By 1 month, and of course the mothers continued to breastfeed, all the mothers breastfed. By 1 month, the exposed children did significantly better on all of the variables, indicators in the Brazelton Neonatal Assessment Scale, which is the scale we use to measure. It's a common scale to use neonatal neuro and behavioral development. And we're, again, not convinced that that amazing finding, again, counterintuitive finding, was a result of the, specifically, of the cannabis itself. Those mothers who were heavy users of cannabis were also mothers who lived as a different lifestyle than most women in Jamaica. And we do believe that there were aspects of that lifestyle that provided additional protection and attention for neonates, that created a better neonatal development environment for those children. So we would attribute it to the cannabis only tangentially. And when we looked at those same children at age 5, they were all over the place. There was no consistency. So it was clear that the impact of the environment is really the issue, that a cannabis exposure during the prenatal period really is, at the very least, we can say there's no harm. There's no harm. But whether, as some Jamaicans would like to say, well, it actually makes children healthier, you have a healthier baby, I'm not sure that's true. The babies of the exposed group did weigh more, but not significantly more. But when we told the moms, they said, well, of course our babies weigh more. We eat more. And women also attributed that to the reduction in the nausea of the first trimester. They felt that they could get good sleep using ganja, reduce their nausea, and improve their appetites. So they were positioned to have healthier babies.